is a trial looking at trying to reduce hospitalization for patients with atrial fibrillation. And the intervention here was really a home-based education session where we taught patients key messages and provided them an action plan on how to avoid hospitalization.
You know, I think out of everything I've seen at ESC this year, the HELP AF trial is probably the most important study that was presented. My colleague and friend, Prash Sanders, actually went back to basics. He started engaging patients with education, with support, with the simplest of things.
So the 4 areas were medication, the use of stroke prevention and medication to prevent that. We introduced the concept of lifestyle management to reduce the burden of atrial fibrillation. And finally, we looked at an action plan on how to manage acute episodes of atrial fibrillation.
You know, control your blood pressure, lose weight, make sure you exercise, make sure you understand how to approach a recurrence of atrial fibrillation so that we don't just run back and forth to the emergency room, go back to the hospital.
The important results were that we were able to reduce all-cause hospitalization, unplanned hospitalization by 26%. We were able to reduce AF-related hospitalization by 31% and other cardiac hospitalization by 49%. These are dramatic results and really suggest that we need to have personalized but structured educational programs for patients with atrial fibrillation if we're going to try and avoid hospitalization.
In the U.S. today, we spend more money per person as a percentage of GDP on healthcare than anywhere else. And part of it is we're too busy being concerned about expensive new biologic drugs, expensive new treatments, when in reality, let's just talk to the patient, let's support the patient, empower the patient, engage the patient so that, just as Dr. Sanders said, we can prevent hospitalizations. He showed it to be true in Australia. Imagine what we can do with the resources that we have in the U.S. if we're able to prevent unnecessary hospitalizations just by engaging and empowering the patient.
So what we've provided already out there is all of the education material that we used as part of this study. What is going to need is upskilling in a method called structured educational visiting, and there are several centers around the world that actually train people in how to deliver this. This is a simple concept. It's a concept that the pharmaceutical industry has used really well in the past on how to market things and achieve behavioral change. The reason we took this into the home was to empower the individual. That's a situation they feel strongest in, and it allows them to then use this to manage their atrial fibrillation. This is definitely scalable, and it's important that we scale this and implement this around the world because this is a major issue for us in all countries.